Dr. Ferrer. He is the Executive Director of the Boston Public Health Commission, and he's been the Director since 2007, and previously was the Associate Commissioner. As you all know, public health, state public health department, Boston Public Health Department are very, very important parts of our efforts to bring particularly preventative care, public health care, to the Commonwealth. And Dr. Ferrer has worked on a number of very important issues and strategies for things such as reducing infant mortality, which, if I'm correct, I just heard on the radio yesterday or today or the day before that we're getting some money for that. Boston's getting some money. That's great. Well needed. Definitely needed. And also, she has worked on the issue of racial and ethnic health disparities, which is something that many of us in the legislature have been very concerned about. And I suspect also is correlated with this issue of paid sick days. So, Dr. Ferrer, we're very happy.
Thank you very much, and thank you so much, Representative Wolf, both for inviting me to speak, but also, more importantly, for your leadership on so many issues that are important to families who live throughout our state, really central to their well-being and health. I am going to follow up a little bit with the comments of the previous speaker about, sort of the public health concern. Why is the public health director here? Why do I think that this is an issue that we need to weigh in on and really support this piece of legislation? And I want to actually go back to the spring and give some real examples of how important it is for all workers to have protections that allow them to stay home when they're sick, or allow them to stay home to take care of sick family members. Boston was very hard hit by H1N1 influenza. I'm not sure that people who don't live in Boston know exactly how hard hit we were, and we continue to grapple with cases even in the summer. But we estimate that 23,000 residents in Boston were actually infected with influenza-like illness, and that that 99% of that influenza-like illness was H1N1. Again, testing protocols do not allow for everyone to get tested, but based on our surveillance systems, we were very hard hit. What's more astounding is fully 10% of our estimated cases in Boston were school-aged children, 5 to 17. 10% of the 5 to 17-year-old population in Boston, all of the kids who live in the city, were actually infected with influenza. That is one of the highest rates across the country. We had flu in every single school. Over almost 50% of Boston public schools had at least 2 days where attendance was significantly worse than it was at the height of our usual flu season in February. We're able to track attendance, so we actually have data. And when I say significantly worse, I mean that the variance was more than 10% for at least 2 consecutive days. We closed 15 public schools and 5 additional private or parochial schools in the city of Boston. That's 20 schools, which means thousands and thousands of children needed to stay home for 7 days while their schools were closed because we had so much spread in our schools. Now, what made Boston so different? One issue that makes Boston so different is we have a lot of low-wage workers, particularly parents of school-aged children in Boston public schools. And many of the low-wage workers had absolutely no ability to stay home for 7 days while we asked them to care for children who were sick with influenza-like illness. And if people will remember, for the vast majority of children who are sick, and even adults, it is a fairly mild illness. When I say mild, it means that most people don't get complications, but they do run fevers. And those children who are sent to school pumped up with Tylenol in the morning, by 11 o'clock, the Tylenol is wearing off, and they are in the nurse's office with 101 and 102 and 103 degrees for their temperature. They are running fevers, and they are spreading their virus to other children in the school building. This is spread by respiratory droplets. Kids are very close together in school buildings. It is almost impossible not to spread the virus from one child to another in a school setting. So, and we know that parents were unable to keep their children home because we often sent those children with fevers home with a note that said they couldn't return for 7 days. And lo and behold, 3 days later, the children were back in school. And the parents were not able to come get those children, were not returning phone calls. And when we spoke with them, they were honest in admitting that not only weren't they going to get paid for taking any more time off, they would lose their jobs. So when you think about the reality of infectious disease spread, not having policies that protect workers makes it virtually impossible for us to contain the virus early on in an epidemic. And in fact, ended up costing both Boston and businesses a lot more than they anticipated. We don't have the authority as a public health department to mandate a sick leave policy, but we do have the authority to close schools and businesses, which is all that we're left with to protect the public. So, not having policies that allow people to stay home and take care of sick children, or stay home and take care of themselves when they're sick, really results in sort of much more draconian measures by the public health department, which is the only way for me to contain and stop transmission in a school building when kids continually show up sick is to close that building. Why some schools closed in Boston and other schools didn't was directly related to the number of sick children that were coming into school every day. If we couldn't keep sick children out of the building, we had to close at a certain point. You got 10, 20, 30% of your kids absent, and you have sick kids coming in every day, you have to close the building. The other issue that urban centers face is we have many children who are medically fragile, and we have at least 15% of the population are children with asthma. Asthma is one of the complicating health issues that definitely affects your ability to fight off a virus like H1N1 influenza. So when people say children have underlying conditions, they're talking about asthma. They're not talking about heart disease for children. They're not talking about kids who necessarily have cancer. They're talking about something that is as common as asthma. So again, when you think of sort of the job of protecting the public, the job of protecting children in schools, you think 15% of our public school students have asthma, and we have programs for medically fragile kids in many of our other school buildings. You can understand how important it is that the public health message, if you're sick, you need to stay home, becomes central to really eliminating widespread transmission of the disease. As we prepare for the fall, it's our job to sort of go around now in the summer and speak with all the businesses and the unions and families and clergy and ask them to be prepared for what we have been told by CDC will be a very severe flu season. With lots of people with flu and the inability to separate seasonal flu from H1N1 influenza. But the very real possibility is it does not look like H1N1 influenza is going away. It looks like it will just be coupled. We will have a very long flu season. It will start probably in early fall and continue all the way through the spring, which is months and months. And our ability to actually not repeat a sort of a Mexico-like situation where we close down the whole city is in fact dependent on having a lot of cooperation from our business leaders and our community-based organizations around sick leave policy. So if there ever was a time where we'd ask that there be swift passage of this legislation, it's now. Because we actually, we're not trying to be alarmists, but we think we need to be very well prepared for severe outbreak of influenza, and we count on the ability to be able to tell people they need to stay home when they're sick. So thank you so much for sponsoring the legislation and for your interest in getting the legislation passed.